Welcome to the Waldenstrom's Macroglobulinemia Patient Perspective video series. I'm your host, Sharon Piotrowski. Today's topic is to explore how one found out that they had Waldenstrom and what were their symptoms. WM patients' journey to diagnosis, along with their symptoms, can vary from person to person. Today, I'd like to tell you about my journey to Waldenstrom's and what were my symptoms. Well, my journey began in the fall of 2018. I had gone for my annual physical, which includes blood work, and I was told that I had a low white blood count of 2.7, and anything under 3 was concerning, so they said I needed to see a hematologist. So I scheduled an appointment next with a hematologist in January of 2019. They couldn't see me any sooner than that. But I started having issues with my stomach. I've always had issues with my stomach. Sometimes I would eat and then I'd get a bloating pain, but it was just really random. So maybe once or twice a month. Well, I thought what the doctor was going to tell me is that I didn't have to be here, that there was nothing wrong with me. But he actually told me I did have a white blood count that was low and that I was anemic. So he just wanted to run some tests and find out what was going on. So when I went back to him, he told me I had this thing called low monoclonal B-cell lymphocytes, or MBL. He said usually when they're low, they don't mean anything, but when they're high, they can lead to chronic lymphoma leukemia, which is a cancer, CLL. But mine were low, so he just thought to be proactive, he would have me go do a CAT scan. And then he also wanted to do an iron infusion because I was anemic. Well, I had the CAT scan, and sure enough, there was a slight increase in my spleen, just very slight, and also my liver was slightly enlarged. I did tell my oncologist, the hematologist at that time, that I was starting to really feel these stomach pains and bloating, and that I was also having some night sweats. But he really didn't think too much about it. He just basically told me to go home and not think about it and come back in 4 months. Well, he told me to put it out of my mind, but I really couldn't because those pains in my stomach and the bloating seemed to be happening more often. So I think I told you once or twice a month. Well, now it was happening probably more weekly. And then those night sweats started to become drenching. But I really still didn't think too much about them because I was postmenopausal and I know women could have night sweats. But then it was getting very uncomfortable, so I decided to go see my internist, who sent me to a GI doctor who decided that I needed to have an endoscopy and a colonoscopy. I never went to those procedures because my bloating was really bothering me a lot. So I felt like I was 4 or 5 months pregnant. Then I felt this hardness right underneath my left breast that went down the side of my body. So my internist scheduled another CT scan and about 10 pages of blood work. So I found out the results of the CT scan and my blood work. My spleen was more than double in size. Your spleen is about 4 inches, sitting right underneath your left breast. Mine was 8.5 inches long. I'm not that tall, so it was pretty much down the side of my body. Also, all my abdominal lymph node glands were also enlarged. My blood work, almost every page had red on it. So my internist said, you need to see a surgeon, get that spleen out. I go to see the surgeon and he said, I can't take that out. You need chemotherapy. And I almost fell out of my chair. So I did have other symptoms by the time I saw my current oncologist. I started to have a blurry vision, cramping in my legs. I had had Raynaud's syndrome before, which is you get this cold, numb feeling in your fingers or toes, and it seemed to intensify. I also lost weight and I was really fatigued. After my diagnosis was confirmed by bone marrow biopsy, I did start treatment. So with these symptoms, which I was really surprised, and I think my oncologist was, my daily life really wasn't impacted much. I'm very much into exercise. I weight train, run, bike, and the day before I saw my current oncologist, I had honestly done about 25-mile bike ride with this really swollen spleen. So I want to share with you my final thoughts. I really think you need to trust your instincts. If you don't feel good, go see a doctor. What's the worst that can happen? They say there's nothing going on. I think also remember, WM patients vary in their symptoms and their journeys. So you might not know or be similar to somebody else, or you might be. There's just so many different varying symptoms and journeys. Go on the IWMF website, become educated, look at their YouTube videos from their specialist doctors, and be your own best advocate.